Welcome to Dr. Baliga's podcast for the Curious Doc. Today is May 27, 2026. This video is in a Lancet article published online first on May 21st, 2026, titled Coronary Microvascular Dysfunction and Cardiovascular Outcomes, the FLOW-CMD Registry, a prospective multicenter cohort study in South Korea. There's an accompanying commentary titled Microvascular Dysfunction in Atherosclerotic Coronary Disease. Prospective multicenter FLOW-CMD Registry evaluated prevalence and prognosis of coronary microvascular dysfunction in patients undergoing clinically indicated invasive coronary angiography in South Korea. Study cohort comprised of 1,003 patients enrolled from 7 tertiary hospitals between April 2022 and November 2024. Median age 65, 75.4% were male. CMD is defined as coronary flow reserve less than 2 and an index of microcirculatory resistance IMR equal to or greater than 25. Obstructive epicardial coronary artery disease defined by fractional flow reserve of less than 0.80 or severe stenosis requiring revascularization. Median follow-up 1.9 years. Primary endpoint all-cause mortality, myocardial infarction, repeat revascularization or heart failure hospitalization. Cox and Kaplan-Meier proportional hazard models were used. CMD or coronary microvascular dysfunction was observed in 16.3% overall, including 21.5% with obstructive epicardial disease and 9.3% without obstructive disease. Primary endpoint occurred in 18.8% with coronary microvascular dysfunction versus 10.5% without coronary microvascular dysfunction. Hazard ratio 1.91, p-value equals 0.0047. Cardiac death was 6.5% versus 2.2%, p-value equals 0.0077. Repeat vascularization was 8.8% versus 4%, p-value equals 0.016. Among patients without obstructive disease, hazard ratio for primary endpoint was 3.45, p-value equals 0.0003. Limitation of study observational design prevents causal inference. The South Korean cohort may limit generalizability. Patients with vasospasm were excluded, and the follow-up was relatively short. Median follow-up was 1.9 years. Key takeaways: coronary microvascular dysfunction commonly coexists with obstructive coronary disease and independently predicts adverse cardiovascular outcomes despite revascularization guided care. Editorial perspectives and caution. The accompanying Lancet commentary emphasized that coronary microvascular dysfunction should not be viewed solely as a disorder of angiographically normal coronary arteries. It frequently coexists with atherosclerotic epicardial disease and may worsen ischemia, symptoms, and prognosis. Important cautions: the registry population was highly selected. The extensive coronary CT angiography used likely enriching the cohort for obstructive disease. Male predominance 75.4%, and high PCR rates may limit extrapolation to broader chronic coronary syndrome populations. Potential biases: the clinicians were not masked to physiological findings. Persistent angina may have prompted repeat PCI and inflated revascularization rates. Coronary microvascular dysfunction prevalence might therefore differ in other practice environments. Mechanistic insights: structural coronary microvascular dysfunction endotype with abnormal CFR and IMR appeared associated with worse outcomes, potentially reflecting myocardial fibrosis and impaired exercise physiology. Future directions: there's a need for longitudinal studies assessing whether coronary microvascular dysfunction improves after PCI, incorporation of vasomotor testing, and trials evaluating stratified therapy guided by coronary functional testing. Clinical pearls. CMD is not confined to patients with normal coronary angiograms. Combined assessment of epicardial stenosis and microvascular physiology may improve risk stratification. CFR and IMR provide complementary information beyond angiography alone. Patients with CMD had higher risk cardiac mortality and repeat revascularization rates. Persistent angina after apparently successful PCI should raise a suspicion of CMD. Structural CMD phenotype with low CFR and elevated IMR may represent a higher risk subgroup. No major complications related to invasive physiological assessment were reported in the registry. Future management may shift towards integrated epicardial and microvascular treatment strategies rather than stenosis-centered care alone. This is an infographic on this Lancet paper. Hit pause and read this exciting Lancet article at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.